First of all, kudos to the Yanks. My videographers, and if it's wrong, it's their fault, just told me they signed Stanton on the Yanks. I'm a big Yankee fan. Him, Judge, and the whole thing, really exciting. I hope to be at a World Series game up in the South Bronx in 2018. Okay, this video is going to be about some of the patients whom I've dealt with. You know, I'm a big fan of Gary Vaynerchuk, or Gary V, and he talks about self-awareness, empathy, and humility. I had to look down and want to make sure I had those words right. And I can't think of a better field than optometry. I want to discuss a couple of cases that came across. One was at least 15 years ago. It was referred to me from a fellow patient. This lady came in and her main complaint was after her surgery, she started walking into walls. And they said, unfortunately, nice doctor, that she's malingering and making it all up. In other words, she could not walk a straight line. When she was walking, thought she was walking straight, she'd veer off to the side. So he examined her. She was 20/20 in each eye, which is normal, but we did a peripheral vision test on her. And what you do in a peripheral vision test, you cover one eye, and everything, when she was looking straight at the target, she could see everything over here and nothing over here. When we covered this eye, she could see everything again over this thing on the right side, but nothing on the left side. Nothing over here on this side of the nose. So she had what was called a homonymous hemianopsia. In this case, a right field hemianopsia. So everything was kind of skewed over to one side. She had no balance of her whole visual world after the surgery. Now, some people could adapt to this. She could not. So she kept walking into walls, and nobody told her. Here's the thing. Nobody told her what her problem was after the surgery. They just said she was making it up, malingering, and she was extremely depressed. So we found out what the problem was. That's half the thing. When you tell someone they have a problem, and it's not all in their head, that there really is something that's wrong with them, that's half the battle. The other half of it is trying to treat it. So what we did was, we actually prescribed something called prisms. And we put the prisms in such a way that we were able to shift the world over to the side this way. In other words, what was missing, we just moved over. And what a dramatic difference it made in her ability to perform. First of all, she was able to walk a straight line. That's something. Secondly, she was able to read better. Third, I believe she was able to drive her car, and this was a major, major thing for her. And you know, you really feel good when you do something like this. As Gary Vee says, give more to the others than you can ever hope to get back. This is one of the things that happened. Okay, this is kind of a picture of a visual field, and it's sometimes hard to explain, but as you notice, this is the eye, this is the visual track. The visual fibers go until they hit the back of the brain. When there's a problem in this area here called the optic chiasm, there could be a binocular, a two-eye problem. As you see, part of the image coming to the back of the eye is either coming onto the temporal or nasal part of the eye. As it starts to cross over here, this is where you find a problem where a kind of an aneurysm or a tumor could lead to a problem which, when you're measuring the peripheral vision of the person, it shows up in both eyes, as it did with that patient. A one-eyed problem could be just with the eye itself. But when there's a two-eye problem in the visual field and it's symmetrical, in other words, it's the same defect within each eye, you better know it's in part of the brain. And that's what we're interested in, and that's why we were able to make those diagnoses with those two patients in mind, to know that it was a brain problem, and not in one case in the person's head, and the other case where it was actually the aneurysm, where it was probably in this area right around here.